Hi there and welcome. So today we have a very special recording, but before we jump on into things, let's go ahead and introduce myself. My name is Juliana Hock and I'm the owner of Easy ADHD Coaching. I help people who may or may not be diagnosed with ADHD, and I help you go from uncertainty to feeling in control and productive. Welcome to Easy ADHD Coaching. And as we all know, ADHD is real, and receiving a new ADHD diagnosis can be challenging, navigating those things, and then learning as a parent what ADHD is and collaborating with your child to help them self-regulate in the moment can all be new things for us. So to learn more about family coaching, whereas the parent is collaborating with the child to learn about their ADHD and these things, I have a very special guest. And without further ado, Dr. Nadimire Jules-Dole, also known as Dr. JD, is a board-certified child, adolescent, and adult psychiatrist in a private practice at Paragon Integrative Health, located in Ellicott City, Maryland. She completed her adult psychiatry residency as well as child and adolescent psychiatry fellowship at Johns Hopkins Hospital in Baltimore, Maryland. After completing her fellowship, Dr. Jules-Dole worked for many years in different clinical settings, including outpatient, residential, and schools. She decided to open her practice in 2022 in order to provide an array of services, including psychotherapy, medication management, as well as complementary and integrative interventions. She is passionate about helping kids and adults achieve optimal mental health and well-being, and sees patients in person and remote throughout Maryland, DC, and Virginia. Welcome, Dr. Jules-Dole. Thank you so
Thank you
much
so
for
much.
being here.
Yes, thank you, Juliana, for having me.
And without further ado, let's jump on into the first question. And as we started this conversation with, ADHD is real. And as I've mentioned in other YouTube recordings, that ADHD is so much more than what meets the eye, whether, the child, talks a lot, is disruptive in class, whereas the girl child who is shy in the back of the classroom, we don't want to misread these signs as this child is bad. We want to take a deeper step into understanding what's going on in their head. How, how are they processing? What's really going on for them? So without further ado, this takes us to our first question of how can ADHD be understood as a mental health disorder?
So ADHD is a neurodevelopmental disorder, which means that symptoms are first present in childhood, specifically before the age of 12. It affects about 8 to 10% of youth and 4% of adults, and is diagnosed based on the presence of various symptoms, some of what you had mentioned already, related to inattention, hyperactivity, impulsivity, and it negatively impacts a person's ability to function at home, at school, at work, and in their relationships. It's a treatable condition and requires a multi-pronged approach in order to achieve success.
Well, how beautifully said, and thank you. And thanks for acknowledging what's on the surface of ADHD, but also under it. And I know for me, when I was getting, just getting my diagnosis, this is 2019, I didn't have any idea that ADHD was related to mental health. So I think it's phenomenal that our listeners can start with the education of, no, it is including our mood and that sense of, achieving that life fulfillment, feeling good about ourselves. So thank you for mentioning that. And that takes us to our next question of what are effective strategies for supporting a child diagnosed with ADHD in an educational setting to meet their specific needs?
Sure. So I would say, firstly, communication between the parent or guardian and the school is key. And so talk to your child's teachers to understand what they're observing in the classroom and ask what interventions the school can put into place to help your child. Some common ones include preferential seating, which helps them to reduce distractions. They can have movement breaks, maybe access to fidget tools, and reassess to see if these interventions are working. If they're not working, then the child might need more intensive accommodations via a 504 plan or an IEP, which require team meetings with the school to implement the plan and track progress. The second thing I would say is it's important to talk to your child about what they need at school in order to achieve success. Some kids in my practice with ADHD don't like to use accommodations, even though they have them, because they don't want to be seen as being different. And so they might not be able to use, they might not be using all the resources that they have. But when their demands are increased, when they have more difficult tests, they might then start to access those resources. And so initially they might not be able to use them because of certain thoughts that they have about it. But as things get a little bit more difficult, they might say, you know, Mom, Dad, I actually do need some of these resources, and they'll be able to talk to their teachers and supports at school to gain access to them.
What everything you said is so real. Because starting with, I remember being the kid who, I remember, this is not relative to ADHD, but my dad, when it was cold outside, and my dad said, "Why don't wear a hat? It's freezing." And I refused because no one else was. I had to be,
Mhm,
I don't know, the second grade. I was young enough where I cared so much about people's opinions of me. And it's
mhm,
just, I can completely relate to the child not wanting to be seen as different, but how impactful these accommodations are. And I just also want to say, I think that's great that to start with observing the child in the classroom, because we see those symptoms so early on, and
mhm,
like to not ignore them. But I just think that's a great first step, is observing, seeing what is truly going on. And I think that accommodation element you brought up is depending on if you're in a public or private school, these accommodations such as 504 and IEP plans can be available to you. So the
mhm.
first step is just knowing that, and
Right.
that we can start. But I really like what you said, the observing part. And what you also said something that I see in a lot with my adult clients, of the increase in demands, especially after the pandemic hit. Had an increase in demands, or a mom who, only had to manage their life, and then now having to manage their child's life. That's a lot of increase in demands, also that executive function. I mean, you're spot on. So I just wanted to say thank you for acknowledging that. And as Ross Green says, if a child, if it could, would, they could, or
Mhm.
they could, they would. So I really like everything you're saying. So that takes us to our next question. And before I, you know, paint this, before I ask this question, I wanted to paint the picture that so often, if I had to put a percentage, at least 60% of parents receive a diagnosis in adulthood due to their child getting a diagnosis.
Mm.
So just acknowledging that piece, and that takes us into the next question of what guidance can be offered to parents in managing their child's ADHD.
I just want to comment on what you said,
Okay.
Juliana, just earlier about the fact that as an adult, the parents or guardian might not have realized that, oh goodness, this is ADHD. This is what it's called that I'm experiencing, until their child gets that diagnosis. I do see that in my practice as well, and it can be pretty transformative to know that, okay, this is what I'm going through. This is what it's called, and there's treatment, and now I can have access to that treatment. That's pretty powerful. In terms of advice that I would give, three pieces of advice: you are not alone, you are not alone, you are not alone. You see a trend there. And so it's so important to know that you are not going through this by yourself on your own island. And so leveraging your supports in the form of professionals like myself as a psychiatrist, like you, Juliana, as an executive coach, leaning on family and friends, all of these people are there to help build a community for you to take care of your child and yourself, because again, you can't do it alone.
Yeah, thank you. And that just reminds me, it screams Caroline McGuire saying it takes a village when
Mhm.
we're learning these skills, because executive function includes those, working memory, how to, be productive, be organized, get started on tasks, but also the social skills of being able to self-regulate, being able to talk to people, to communicate your needs, to get what you want, to get your accommodation. So thank you for bringing that up, because um, for me, as a 31-year-old, navigating their own self-discovery through their diagnosis, when I feel like I reach one pillar of reaching a height of like mastering a challenge. I hope I'm
Mhm.
communicating this correctly. It's another challenge comes up that I want to master, so it's not so challenging for me. So
Mhm.
just, no, just piggying back what you said, it takes, you're not alone, because there's so much support for us. Sometimes, like, I just didn't know this support could help me with this challenge. So, just don't give up on yourself, don't give up on your child, and to know that you're not alone. Like, thank you. That's like so beautifully said. And thank you for pointing out also the psychiatrist element. So in your bio, you mentioned the psychotherapy, medication management. So whereas Dr. Jules-Dole can first help you get curious on, you come to her with that observation, and then we can get started with the diagnosis element. Like you said, symptoms could start coming up before age 12 or as early as age 12. So coming to see a psychiatrist like Dr. Nadimire or Dr. Jules-Dole to help you first get that diagnosis and start the first step of navigating that diagnosis, and then to see an executive function coach such as me to help you sharpen those skills and learn about those skills. So thank you for letting me put that in between right there. So thank you. So this takes us to our next question of, how can parents and children collaborate to achieve success given a diagnosis of ADHD?
So I would say the first thing is effective communication. And so encouraging your child to share their thoughts and feelings. And that might be checking in with them every day. How were things at school? What were things that were working? What wasn't working? This helps you to identify issues as they come, so you're being more proactive as opposed to reactive. And that communication is not only going to be with your child, but also their teacher, checking in with the teacher periodically and finding out how your child is doing in school, what additional supports they might need. And so communication is the first thing. The second thing I would say is establishing structure and routine. Kids thrive on the consistency of having structure and routine. It helps them to reduce their anxiety if they know what's going to happen next. And it helps them in terms of providing that executive function in terms of time management
Mhm.
and the ability to start being responsible for certain things. Okay, I know at 3 o'clock it's homework time. Let me get my pencil and paper and homework and all of the things I need in order to get ready for this homework time. And so it helps put into place certain key reminders for them if they know what to expect ahead of time.
Mm.
The other thing I would say is celebrate the wins, no matter how small. This is a challenging diagnosis for both parents and kids, and it's so important to acknowledge and praise your efforts, especially with kids. They are often inundated with negativity, negative comments. You mentioned earlier, Juliana, about behaviors that they often can't control. They can't control it. If they could have, they would have. And so giving them that praise helps their self-confidence. It helps them to feel better about themselves. And so it also helps you as a parent to know, okay, I'm doing the best that I can. This happened today. We did a really good job. I think it's, again, so important to celebrate the wins. The other thing I would say is setting clear expectations. So making sure that the child understands what's expected of them at school, at home, and checking for understanding, because sometimes kids will say, well, I didn't know that I had to do X, Y, Z. I didn't know. And so that helps to remove that barrier, or at least being able to talk to them about, okay, this is what you're supposed to do. What happened? What do you need? Again, this is an opportunity to put in supports in place if they understand their expectations and they're still having struggles. What's getting in the way? And the last thing I would say is helping to teach coping skills. And so things like deep breathing, mindfulness, exercise is a great coping skill. And it helps to, especially kids that are hyperactive and impulsive, it helps get that energy, the energy out to help ground them a bit more. And so those are some of the things I would say in order for parents and children to collaborate to achieve success.
And you had a lot of good stuff in there. So I just want to say a statement, and then I had a question that after what you said, but I just want to explain to our listeners what expectation means, because I didn't know how important expectations were until I was a grown adult. But what this means is your child is also the working memory of, okay, giving an instruction with 4 pieces, but just knowing what is expected. So giving clear instructions. Another thing is we put so much pride into our children. We think that they're adults with a full grown prefrontal cortex, but they're not. So we give them that benefit of the doubt, which is amazing. But at the same time, we actually need to take a step back and actually give clear instruction. So I just wanted people to understand that, because that has been one of my a reason to my success, is knowing, okay, what is it that I actually have to do? What is expected of me? So I think what you said is really important. Everything you said is really important. From coping skills, celebrating your wins, structure, routine, and communication. So what I wanted to say, to ask you in a way, is I didn't know that you have to feel your feelings in order to process everything, or what are you feeling? So I know this wasn't I didn't ask you this ahead of time. I just wanted to ask you, how can you teach a child to communicate what they're trying to say or what they're thinking?
Yeah, I think that's a great question. And with children, their ability to communicate changes at different points in their developmental trajectory. And so when you have, say, early elementary school, they don't always have the vocabulary to describe their feelings. And so doing things like reading certain stories, there are a lot of really good books about feelings that are very developmentally appropriate at young ages. And so having those opportunities to read to your child those types of books and talking about it as well. And some kids have a hard time verbalizing their feelings because they, again, may not have the vocabulary because they're so young. Drawing it out, so being able to color and draw as a way to communicate is really helpful. And then as they get older, they're able to better communicate what they're feeling. And some kids, they still are having a hard time. And so music is a great opportunity to have them communicate in that way. Some kids are able to grab onto certain lyrics and they can identify with them. They might not be able to describe their feelings, but through the artist's lyrics, they're able to say, okay, this is exactly how I'm feeling, what I'm going through. And so again, communicating and getting to know your child on multiple levels will help you to get that out of them in different ways. If they're not able to say it because they don't have the vocabulary, you can tap into other aspects of their communication and functioning that can be more artistic.
I mean, I really relate to that because I actually think in music lyrics. So if something's going on, whether it's good or bad, will think of a song that I even listened to 15 years ago. Like I haven't
Mhm.
heard. So it's like actually really interesting that you can relate to music. And another thing is I didn't know this till last year, but I'm a picture thinker. I think in pictures. Another really cool thing is when you mentioned drawing it out is, wow, how much expression can be communicated through a picture, and we might not even know that. So thank you for all of those things. And another thing as an ADHD coach is like I am so passionate about processing modalities, how we receive and how do we process information to better understand ourselves, to get things done and be
Yeah.
on time with things. So all of this comes into play with understanding how we receive information. So thank you. And this everything you're saying in this recording sets our children, the child up for success so that they can better manage those emotions and self-regulate in the moment when to self-regulate when hard things happen. So ideally we help teach these skills so that they can ADHD is never going to go away, but we can at least live with it and deal with it. So I
Mhm.
really appreciate everything you're saying and you communicated to us. So it's great. It's instead of reading a book. So thank you. So did we miss anything in this recording? I just want to make sure we covered
No,
everything.
no. I think we covered a lot. Thank you.
So as we mentioned in the beginning of this recording, you do remote work as well as in person, but is there a way for our listeners to get in touch with you?
Sure. So I can be reached at 410-921-9616. That's my work number. And my email address is another good resource. But I think even just going on my website probably would be even better than that. www.paragonintegrativehealth.com.
Thank you. And when they go on your website, they can go ahead and book if they are interested in a diagnosis. So this is a great first step. As we all know, it's hard getting a diagnosis.
Mhm.
I wish it weren't so hard. So this is a great first step for all of my local listeners in the Maryland DMV area. Thank you so much. And thank you so much for being here, Dr. Jules-Dole. And I appreciate the wealth of knowledge you shared with us. Thank you.
No problem. Thanks for having me.
Okay, I'm going to go ahead and end the recording.